Welcome. I'm glad you guys are here today. I know it's super early on a Sunday morning, so if you're still waking up, so am I. I'm Holly Lipschultz from Student Disability Services, and I'm just going to give an overview of what our process is and how we might help your student if they're struggling. So Student Disability Services help people who are struggling with psychological disabilities. That can be anxiety, depression, things like that. We can help. Learning disabilities, physical disabilities, and any temporary disability. So if for some reason in the winter your child slips on ice and gets a concussion, we help with that too. So the process is pretty straightforward. If you find that your child is, calling home and struggling, saying, I'm studying for so long, I don't know why I'm having to study twice as much as my classmates just to absorb the same material, or I'm really depressed and I have a hard time making it to classes. Just have them come talk to us. We have an interactive process. We figure out what kind of stuff might help them. Maybe it's flexible attendance policies. So like if your child is depressed or anxious and just can't make it out of their room, we have a flexible attendance policy where they can notify the professors and say, I'm sorry, I just can't make it today, something like that. Just come talk to us. We have them fill out forms, and then after the determination, we provide a letter that they then provide to the instructor that tells them, I need note-taking, I need time and a half on exams, things like that. And that letter is shared with the dean of students, so that way if the professor ever has any issues with the letters or questions, they could come to us with the dean of students to ask questions or clarify accommodations. That's pretty much our process. We try to make it short and sweet. So anybody have questions? Bueller? Okay. Alrighty.
Good morning, everyone. Thank you for joining us this morning. My name is Jennifer Connor. I'm the Director of Operations over in the Student Health Center. Me and some of my colleagues are here today to describe to you some of the services that we offer here on campus for your students, and we'll take questions at the end. So to just cover really what our mission is with student health and counseling, we are really here to provide the services that your student's going to need at the place that they need it. We work very hard all year long to make sure that the services that we provide are convenient and accessible for the students, and also of high quality. So we really value the care that we give. First, I'd like to just introduce you to something called the Student Health Advisory Board. We call it our SHAB. It's a group of folks from around the university campus that come together to talk about student insurance, student health, student counseling. This group is made up of not only students, but faculty and staff. And it gives us a time to come together and to be able to discuss maybe different health issues on campus, talk about what type of insurance plan we need for next year, and so on. And the students are split up into 3 groups, and every year they decide what it is that they'd like to work on. Several years ago, the students came together and decided that they wanted to make a video to leave as a legacy to incoming students and parents to describe a little bit about what we do. So I'm going to show you the video. The video was completely made by students, and student actors are in it. The scripts were written by the students, and you'll actually recognize some of the people in this room that play some different parts in the video. So I will share it with you right now.
During your time at UChicago, whether you are a college or graduate student, it is important to take a holistic approach to taking care of yourself.
You don't have to do it alone. Student Health and Counseling Services offers the resources and services to help.
Let's explore some of those now. Student health services is where you would go for care when you're sick or injured, but they have so many other services.
Yeah, like gynecological services.
And we provide Pap tests, sexually transmitted infection screening, HPV vaccinations, and contraceptive consultations. And we provide routine physical exams, PrEP therapy, travel immunizations, sports medicine care, and we even provide crutches.
I didn't know you offered so many services. That's impressive.
There's so much more to explore at Student Health Service, but first we need to head over to the other units of SHCS. Student Counseling Services is where you would go for mental health care, like therapy, support groups, and more. Your visits here are confidential.
What does confidential mean?
That means that apart from authorized student health staff, no one has access to your counseling files. They won't go on your academic record, and no one even needs to know that you visited SCS without your permission.
We also have counselors who are specially trained to help students with alcohol, substance misuse, eating disorders, LGBTQ concerns, couples counseling, and more.
We have helpful programs like the Academic Skills Assessment Program and Let's Talk, which offers informal drop-in consultations with a counselor at various locations on campus.
Also, you don't have to be in crisis to make an appointment with SCS. Students are encouraged to visit for any issue they may be facing, whether it seems big or small.
Very cool. I wish we could stay, but there are still more resources to see. So, where are we going now?
We're going to the student health insurance office.
What's insurance? All that paperwork? Oh no, why would you bring me here?
I know insurance can seem overwhelming, but it's really not that bad. And the student insurance staff are here to help.
We are the on-campus representatives of United Healthcare Student Resources, here to offer you guidance and assistance with your USHIP coverage.
Really? Wow, I didn't know there was someone on campus to help. I should really start reading the emails your office sends.
Rookie mistake. Here's some advice. Always read the emails that student insurance sends and pay attention to the deadlines. If you need help deciphering things, call one of the coordinators.
Please do. We're always glad to help.
Okay, yeah, I can do that.
I'm so glad you finally understand the importance of insurance, but there are so many more resources to see, so we have to go now. Bye, and thank you so much for your time.
Hey, I know where we are. This is the Health Promotion and Wellness Office. They do public health initiatives on campus.
In my house, the Well Czars and peer health advocates reduce the risk of sexually transmitted disease and unwanted pregnancy.
How?
They provide safer sex resources, present sexual health workshops, and train the Well Czars on where to refer their classmates if they need help.
That's a great example. We actually reduce risks on campus by training the UChicago community in how to respond to signs of mental illness, and then we provide alcohol education on how to plan safe events on campus.
But how do you promote balance?
Well, we promote balance by focusing on the 7 key facets of wellness, and then we link students to the resources, the events, and the programs on campus that actually help develop and maintain those facets.
Yeah, I build my physical wellness by attending weekly yoga, my emotional wellness by practicing mindfulness, my social wellness at uncommon nights, and I explore multiple facets of wellness by attending Wellapalooza.
I'm impressed. How do you find time for all of that?
Well, it's not easy, but I make time because I understand how important it is to take care of yourself. And with all the student health and counseling resources available on campus, it's not hard to find help.
You're right. Why doesn't everyone know this?
I don't know. Let's tell them now.
Hey, UChicago. Whether you spend all day in a lab or in the library poring over texts or in the field collecting data, we want you to be successful.
Success starts with taking care of yourself. Student Health and Counseling Services is here to support and guide you through this process.
Great, so I hope you enjoyed that. We thought it was a little bit fun and a little bit educational, and the students seemed to enjoy it as well. We're very proud of our students for putting that together for us. I wanted to cover next something called the student life fee. So you may have noticed on when you get the tuition bill, there's something called a student life fee that's attached to that. That student life fee covers all the services that you will be hearing about today. And all students on campus are required to have insurance. So this next slide talks a little bit about what is covered under the student life fee and then what may be billed to the insurance companies. The slide on the left really talks about what is covered. I know it may be a little bit difficult to read, lots of data on there, but for instance, at Student Health Center, the students are able to come in and have a physical exam done, and there is no charge and no billing to the insurance company. There, we have a list of highly used and most often frequently used labs that we provide at no additional charge. We do Pap test and STI screenings. We can test urine. We can do strep testing. We can give immunizations, and all flu shots are free of charge. Under student counseling, you can see if a student were to go to student counseling, short-term therapy would be covered, crisis intervention would be covered, and support groups and things like that. Now, on the right-hand side, you could see services that may be billed to the insurance. These may include some pharmacy medicines that the student gets anytime they would go to the emergency care or emergency room, the x-rays that they would need to get, and on the bottom, it talks a little bit about student counseling. So any type of long-term therapy would be billed to insurance. When students come into either student health or student counseling, this is a conversation that we have with them to make sure that they understand this, while we provide these services and this won't be charged, this might be charged, and maybe you need to have a conversation with your families to make sure that it's okay to move forward. Something that we cover with these students is making good choices about their health care and talking a little bit about what the cost of that is. To point out on the left-hand side of the slide that the student clinics are free of charge for them, so we really encourage the students to use those services. We have a nurse advice line that is available 24 hours a day, so if the students have questions about should they be seeking care, what should they be doing at home, where should they go next for care, they can call in to our clinic and be connected to a 24-hour nurse who can help guide them through those choices. The next rung up on this arrow pointing out the Healthiest You option, which is a telemedicine option. We wanted to point out that telemedicine is one of the things that is on the rise in healthcare, and this is simply where a student can use their phone and video Skype in with a doctor 24 hours a day. A lot of insurance companies are offering this, so if your student is covered by your own insurance company, I really encourage you to look and see what that might be, if there's any charge associated with it. If your student is on our USHIP program, that is available to them free of charge through United Healthcare Student Resources. So I would ask that you look at that and make sure that the students understand that maybe that's something they would want to use after hours or maybe on Sundays when the clinic is not available, so that they can avoid going to a place like the emergency room if not needed. There are convenience centers and urgent care centers around the area in Hyde Park, and so we help students to find those resources when they need them. A few that I will point out is there are several large pharmacies around Hyde Park that have walk-in clinics too after hours when we may be closed and they need to get care right away. And then the emergency room is obviously the cost, high cost associated with it, but it is right here on campus, and so it's right around the corner from the clinic. So how do students access service? We do hand this out to all the students. This is available on our website. There are different numbers listed here that students can call up and make appointments. Certainly they can just come over and we can take care of them at that point. The insurance coordinators, I wanted to point out, are here Monday through Friday, 8 to 4:30. Those insurance coordinators are representing the USHIP, and they are here to help students through decision making and really translating EOBs and different bills that might come through, and then choosing in-network providers. So I'll point out that we have insurance coordinators right here in our audience today. Janice Thomas is right here, and she is one of the insurance coordinators that works here on our campus and is available. We're very proud of this service, that we can have someone here for the students. I'll also point out that our DCAM pharmacy, listed at the bottom, is available for students to fill their prescriptions here within walking distance, so that they don't have to negotiate a shuttle bus or anything else to get to a Walgreens or a CVS or whatever clinic is or whatever pharmacy they'd like to go to. The DCAM is a term that is used for one of the medical buildings right here on campus, and I'll show you in just a second where that's located. So that pharmacy on this map is located in that red box at the top. This map is actually looking east to west, so 59th Street runs down right in the middle of it. The blue area on the map is where the student health clinic is, so you can see that the DCAM pharmacy is located very close, in fact, just right across the street. The Student Health Center is located off of 59th Street and Maryland over on the medical side of the campus. We are inside the medical facility itself, which is very good for us. You would enter off of 59th Street through the Goldblatt Pavilion. On the outside of the building, it also says Comprehensive Cancer Center. The Health Promotion and Wellness, which you'll hear about in a little while, is the yellow building highlighted on the map, and it is across the midway on the south side of campus. Student Counseling Services is the green all the way in the right-hand corner, and that's located on Woodlawn and 56th. So hopefully you have a chance to go over there today and take a look at their facility and hear about their services. So now I'd like to introduce Dr. Marius Commodore. He is our medical director in the Student Health Center.
Okay, good morning, everyone. Nice to see all of you. So as Jennifer mentioned, so Jennifer is actually the person who makes the place go. I just take a lot of the credit for it. And so if you actually ever have questions about things that went wrong, she's the person to speak to. And if things are going well, then I'm certainly the person to speak to. I am the medical director of the Student Health Service. My job is to make sure that the care that we give to your students is evidence-based, efficient, effective, and satisfactory, which are all not the same things, but all part of making sure that their experience here at the University of Chicago is something that is memorable. We hope their contacts with us are brief, and hopefully they never really need us, but if they do, I assure you we stand ready to help them. I don't do this job alone, as I already alluded to. We have a number of physicians, advanced practice nurses, registered nurses, medical assistants, and I'd like to actually especially recognize our administrative staff. Many of them have been with us for 10 years or more, and so they like working with students, they enjoy this population, and they really have a sense of the kinds of needs and stresses and pressures which University of Chicago students undergo. I'd like to also point out that we do have phlebotomy in our clinic, so students don't need to go anywhere else to get their labs drawn. I also like to point this out for students who might need subspecialty care. As Jennifer mentioned before, some of the more basic labs are actually covered under the student life fee and therefore would not hit your insurance if they're drawn. Now, that too can extend to labs that we need drawn for a subspecialist. Certainly, the student life fee will not cover all of those labs, but will certainly cover the ones on the basic list, so that might help minimize some of the cost to your insurance plan if it is drawn in student health. So please encourage your student to remember that. A blurb about some of our services. During the regular semester, which starts on the 25th, we're open from 8 to 6, Monday to Thursday. We're open from 8 to 5 on Friday, and we're open on selected Saturdays. I say selected, which is to say that it is most Saturdays, but I don't remember them off the top of their head. The first one is the 30th. I know that because I'm working on the 30th, but we also have a list of the available Saturdays on our website. We operate via an appointment-based, triage-based system, and what that means is if a student comes to the emergency room and, as I said, their hand is hanging by a thread, we will say, we cannot see you. You should go to the emergency room now. If, however, somebody comes in with, and they look ill, they will be triaged. If there's an appointment available sometime that day, they'll get that appointment. If there is not an available appointment, we will triage them, have them sit with a nurse, decide whether or not there are things that can be done at home. And part of the reason we do this is that upper respiratory infections, colds, and flu-like symptoms are probably the #1 reason why people walk in. So if it is something that we can triage and take care of without necessarily being seen at an appointment, we'll try to do that. I often serve as the backup in case people really need to be seen and there is no additional appointments, so I've done that several times, and I certainly will continue to do that. But the reason we use this triage process is because we have not unlimited resources, and we cannot necessarily pretend that everyone's complaint is equally urgent. And so we try to make the best, most efficient use of the resource that we have. However, I'd like to give you my assurance that if somebody needs to be seen today, we will make sure that they get seen today. However, as Jennifer alluded to, we don't need to see your student only in a crisis. In fact, I would argue that it is when you are well is the best time to see a doctor, particularly if your student has an ongoing medical condition and has already some established care regimen. Then we'd love to see them sometime next week or maybe the week after, sometime early in the semester before work overtakes them and the various pressures overtakes them, because we'd love to be able to have them establish care so that we can facilitate refills, referrals, advice, anything else that we need to do. Not everything needs to be done via visit, but if they establish themselves early on, then we can facilitate some of those things more easily. And then also, if a student does have a condition that requires ongoing visitation, we'll be happy to provide that. Again, that is covered under the student life fee, and so there will not be any additional fee for that kind of routine care. The 24-hour nurse advice line was already alluded to. During the day, that is us. During the evening, that will be a nurse available by telephone. We do offer some specialty services. One of our physicians is a sports medicine physician, so whether your student is a varsity athlete, a club athlete, or just a weekend warrior, if they injure themselves and require some more specialty care, care that we think is perhaps beyond some of our knowledge base, we're happy to refer to her. If she sees your student within the clinic, there is no extra fee. We have one of our advanced practice nurses is a certified women's health provider as well as a certified genetic counselor. So if your student has some interest about being tested for certain kinds of familial or genetic diseases, she's certainly someone with whom your student can speak and make a decision about whether or not testing would be useful, feasible, reasonable. We offer travel clinics, and this is another plug that I'd like to make for you to encourage your student to be proactive. I like to tell the students that the beauty of a vaccine is that once we stick it in your arm, it's yours to keep. So if you know in January or February that your student is going to go to Tanzania or Cambodia or Laos or some other place that requires extra vaccination, they should be seeing us in January. Why? We can give them their vaccine so that they're not waiting 2 to 3 weeks before their departure so that they can get those travel vaccines. So proactivity is what I'd like to make a plug for. We have several flu shot events coming up around the campus. The number one way to keep from getting the influenza is getting a vaccine. So have them, remind them to look out for those. We also have several what we like to call immunization catch-up events. So there are certain immunizations required by the state of Illinois that we will provide free of charge if it is required to just catch up to those immunization requirements. So they should look out for that. Our website is wellness.uchicago.edu. Again, it's wellness.uchicago.edu. Everything I have said is available in some form on that. We also have a TTY phone for those who are hearing impaired. And then if a student is an immigrant and might feel more, all of you know that there's English and then there's medical English and that there's not always the same. And so if a student feels more comfortable communicating about medical matters in a native tongue, we can provide free interpretation services as well. So are there any questions about that? I'll certainly be around after this session anyway if there are more specific questions, but are there any questions about this specific portion? Nope, okay. So then my colleague Dave Albert apologizes for not being able to be here. He is the medical director of the Student Counseling Service. So student counseling and student health are housed in separate facilities, but we certainly work closely when necessary to help facilitate the health of students. They, too, are not a one-man operation. There are several therapists, psychiatrists, a dedicated crisis counselor, and so the Student Counseling Service, I think, is a very well-designed and very resource-rich service available for students who have mental health challenges. There are a number of mental health counseling options available: individuals therapy, couples therapy. There are a number of grief counseling I know is available. There are a number of groups as well. Some of the groups are college only, some are mixed, college and graduate students. The point being, there are a number of services available to try and help manage ongoing mental health challenges that students might have. The one caveat I would say to this is that there are occasions when students may need longer lasting, ongoing individual therapy, and in those cases, student counseling will refer students out to psychiatrists and therapists in the community. They do maintain I think, a rather good list of therapists with whom they have arranged a carve-out to see students for $10 a session with essentially unlimited sessions. So I think that's actually a fantastic benefit. And so if a student requires more than crisis counseling or more than short-term therapy, they will often make referrals to these resources within the Hyde Park community. They have a dedicated crisis counselor, so if somebody walks in that day in a crisis, they will see a counselor that day, and a triage can be made in terms of what will be the next set of services that student will need. They do excellent alcohol and other drug abuse and assessment services, a lot of alcohol intervention. There is a multidisciplinary eating concerns team. So there is an eating disorders team made up of practitioners from the Student Health Service as well as practitioners from the Student Counseling Service. And that group works very well to try and ensure that we intervene with students who may have eating challenges. The Academic Skills Assessment and Support Program, I think, is a very interesting program run out of the Student Counseling Service. There are students whose emotional challenges and the stress around performing here at the university, and the textbook case is a person who is used to easily breezing through work in high school, and then they come to a college where everyone easily breeze through work in high school, and then all of a sudden they feel like they're the dumbest person in the world. Of course, they're not, but oftentimes that stress, that emotional pressure can cause trouble with their academics. And so the Academic Skills Assessment Program is actually very good at helping the student design an individualized program for dealing with those stresses, which may not be psychiatric per se, but certainly involve a performance and an emotional component. And so they do have a very good ASAP. There are also a satellite walk-in services that they have called Let's Talk. So there is a counselor, and there are hours posted. Those counselors are posted at various buildings around the campus. And if a student wants essentially a consultation, they can sit down, they don't have to give their name, and they can sit and talk with a counselor to just have a chat, maybe have an informal assessment. Some of the time, those informal assessments actually do become appointments at the counseling center, but they don't have to. And we did that in order to try and facilitate students who might be a little uncomfortable about seeking mental health care, maybe even wondering if what they are going through even rises to the level of mental health care. And so many of our students think that you have to be seriously in crisis in order to seek help. Frankly, we would much rather you come to us when you're not seriously in crisis to find out that, hey, what you're going through is normal, or hey, what you're going through may require more care. So the Let's Talk services has been, I think, decently well received and will be continuing this year again. We do provide some consultation to faculty and staff, but I think I should be careful here by saying that we do not discuss cases with faculty and staff. Faculty and staff can call, and sometimes we can always listen, but we just can't reveal anything about students. So sometimes a faculty member will call and say, person X or person Y has been missing from my class for the last week. That's not like him or her. I wanted to talk to somebody about how I might intervene, and we're happy to do that. The SCS service standard is no wait list, so there is no wait list. If you come in on Monday, you can be seen on Monday. Generally, the typical wait is 1 to 2 days to see the person who you will be seeing more long term. But this is a service standard that the Student Counseling Service has worked really, really hard to try and achieve, and I think that over the last year to year and a half, they really have achieved that standard. This is how you can get to us. 773-702-9800 is the Student Counseling Service. 702-4156. 4156, yes, sorry. In the day and age of cell phones, I used to be able to remember all kinds of phone numbers, but now I can't remember a thing. And so 4156 is our number. That's the general scheduling number. Should you ever have other concerns, I like to give everyone my email address. It's mcommodore, M-C-O-M-M-O-D-O-R-E, mcommodore @uchicago.edu. As I said, I take only congratulations. Any complaints can be given to Jay Connor, 1 @uchicago. No, I say that only in jest. I like to say, and I truly believe this, that we succeed as a team, and if we screw up, that's my fault. So if there are any things that concern you about the care a student might have received, any question, just a how-to about how your student can receive care, please reach out to me. I'll figure out a way to get them to the person, to the things that they need. And I guess my last plug is have your student call us. You'll be amazed at how many times students call their parents before calling us about a problem that they have. And we are happy to try and problem solve. I know your kid, I remember what it was like being a student 4,500 miles from home, being from the Caribbean, being at the University of Michigan, my parents unable to intervene. It's scary, okay? It's scary, but it is fear they must face. And we're not that scary. I mean, come on, look at me. Like, who would be scared of me? So the point is, have your student call us. We will try and make things right for them, okay? I'd like to now introduce Julie Edwards, who is the director of our Health Promotions and Wellness Unit, which I think of as the public health arm of the Student Health and Counseling Service. Oh, 2 questions. Oh, sure.
Good morning, everyone. As Dr. Commodore said, my name is Julie Edwards, and I'm the Director of Health Promotion and Wellness. And what we do is we try to look at health and wellness from a public health approach. And what I mean by that is that we try to make the greatest impact for the largest number of people. So I'll share with you some of the initiatives that we offer, but you saw in the video our Facets of Wellness framework. And we launched this about 2 years ago now because what we have found is when students come here to the university, obviously they're here for the academics and they're focused on that aspect. But if they're not thinking about these other areas of their wellness, then their academics could potentially suffer. So if they're not eating properly or getting the appropriate amount of sleep or socially interacting with their peers, then that might, after a long period of time, eventually start to impact their academics. And so we use this framework, and when we offer different programs within all of Student Health and Counseling Services, we show which facet of wellness our programming links to so that students can better understand that. Some of the initiatives that we offer, we have both programs and trainings, large-scale events, and then we also customize workshops depending on the area. For some of the programming, we are launching this year something called Brief Alcohol Screening and Intervention for College Students, and that is called BASICS for short. And that's if a student is concerned maybe about their own behavior or about one of their peers, they can refer them to a BASICS program where they will have 2 separate 1-hour meetings with a health educator in our office. In the first meeting, they will take an online assessment of what their behavior is around alcohol. And then in the second meeting, they will review the results together and talk about if the student is wanting to make changes in a certain area. It will show, the results show how they compare both nationally as well as to their UChicago peers. And so after that, sometimes it's eye-opening to them, where maybe it's something that they would want to make changes in later on. And then we also offer something called Mental Health First Aid. And this was launched also 2 years ago. It is an evidence-based program. It's an 8-hour training that we are now offering to students, where we train individuals on how to identify the signs and symptoms of mental health issues. How do you have a conversation with someone you're concerned about in that instance? And then how do you refer them to the appropriate resources like our Student Counseling Center? And we launched it initially training staff and faculty in this area, but students reached out really wanting to be trained as well, because as you may know, students will typically go to their peers first when they're experiencing some difficulties or problems. And so we are now offering one mental health first aid training per quarter, and the first one will be October 14th from 9 to 6 on a Saturday. So if your student would be interested in this and becoming certified, definitely let them know about that. One of the other things that we offer is called Karoo Mindfulness Meditation. And this was something that was developed at Duke University by 2 psychologists there, and they specifically designed it for emerging adults. And what it is a 4-week course, and it's an hour and 15 minutes per week, where we train and teach students skills on mindfulness and really being in the present moment to help them. It helps reduce anxiety and stress. And we do evaluate the outcomes of the program, which we've seen some statistical significance in this area. But students really, we always have a wait list because it's very popular among our students. It's open to both college and graduate. So definitely encourage your students if they're interested. We offer 4 sessions of mindfulness meditation, 4 courses per academic quarter. So definitely suggest that they reach out, and they can also sign up on our website. And the last program that we offer is called the Refresh Sleep Program. And that's an online program. It's more hands-off. They sign up for this program, and then they would receive an email from our office for 7 consecutive weeks. And the email is talking about the research behind why sleep is important, why it will help benefit you in holistic ways, and how do you make your environment conducive to sleep. And so a lot of the times what we find is that our students aren't always taking care of themselves and getting that the appropriate amount of sleep. And so this program can help in that way as well. And it's just something that's online, like I said, that they would get an email from us. But this year we are offering 1 workshop per quarter also around sleep. We also have some large-scale events, so I've included some pictures in the center of them. The first is called Wellapalooza. We bring together about 40 different campus partners and community partners where we offer interactive activities, all geared towards students learning about what's offered on campus and engaging them in wellness activities. And so that event for this quarter will be held October 4th, and it's always on the quad, and it starts at 11:15 and it will end at 1:15. So we have a lot of different activities. I strongly encourage them to look for that. We also bring certified therapy dogs on campus once a quarter, and that's our Pet Love program. And this is a highly anticipated event by our students because they're always looking to come and interact with the dogs on campus. It's typically done during reading period, but it does depend on the availability of the vendor who brings them in. But we typically have 5 to 6 dogs, and we have roughly 500 students that come per event that we offer. And then the last large-scale event is called Uncommon Nights. And this is always held the Wednesday during reading period, so right before exams, where it's an opportunity for students to socially interact with each other with no alcohol involved. It's late night programming is from 12 p.m. until midnight. And it's just, we have fun games, we have registered student organizations, RSOs that come on campus to perform, lots of food and drink, and just an opportunity for students to take a break from studying and interact with each other. So that's called Uncommon Nights. Then we also offer customized workshops around various topics. So sometimes there may be a sorority on campus, or there might be a student group on campus that really wants to bring some education to their peers. So we will bring customized workshops around alcohol and other drugs, self-esteem and body issues. We've done stress, time management, as well as self-care. And so those are different workshops that we also offer within our department. And one of the things that we are launching this year is a campus health needs assessment. And so, as I mentioned at the beginning, when I look at things from a public health approach, we want to make sure that what we are doing, there's an identified need within our student population. We're bringing evidence-based programming onto campus to address that need, and then we're evaluating the effectiveness. And so this campus health needs assessment, we are going to engage students. So I would ask all of you to encourage your students to participate. We will have campus dialogues. They can submit photos of what wellness looks like to them on campus. And we really want to get feedback from as many people as possible, so it helps us see what are the assets that they reach out to when they need care, but then what are the gaps? Are there certain areas that they feel that they don't have access to on campus? So it will give us a good comprehensive look at that as well. And so they'll see flyers called Healthy UChicago around campus, and we strongly encourage them to participate. So that's enough about health promotion and wellness. Now I'm actually going to start talking about student insurance. And as was alluded to when Jen Connor had spoken at the beginning, all registered students are required to carry health insurance at the university. And so they may be covered under your plan. We also offer a university student health insurance plan, or USHIP for short, that is underwritten by United Healthcare. And we have two of our representatives here in the room. So the students, all students every year will have to waive coverage if they are already covered under your plan. So I stress this because if they do not waive by the deadline of October 13th this year, they will automatically be billed for that insurance and they will be covered for the entire year. So if your student is covered under your plan, please make sure that they read the emails, that they access the website so that they can waive their coverage. We have a list of what the coverage that they may be on under your plan, a comparable coverage checklist. So your plan has to meet all of those items on that checklist, and as long as it does, they can waive without a problem. But I just like to stress to everyone, we want to make sure that the students either enroll or waive by the deadline so that they're not charged and double insured if they're already covered under your plan. One of the other things, the annual premium for our USHIP plan is just under $4,000 for the year. It's billed in 3 different installments, so you would see the bill on the autumn, the winter, and the spring quarter billing cycles. The coverage, so even if they enroll today, their coverage is effective starting September 1. Our coverage plan is from September 1 to August 31st. And so that's something to keep in mind as well, so that if they would need coverage and say, for instance, that they knew that they were going to have a doctor's appointment coming up or prescription needing to be filled, they can sign up today and it would be retroactive to September 1. The other thing is we also on our website offer elective dental and vision plans. So that is something that you can also find on our website. So if it's something that they needed vision coverage or dental coverage, they can also sign up that way as well. We have a couple of providers that are listed there, so you would have to choose the option that would work best for them. And any questions that you would have specifically about insurance, you can find it on our wellness.uchicago.edu site, but directly you can go to studentinsurance.uchicago.edu to find answers to any of the questions you may have regarding the student insurance plan. So I'd like to stop here and just see, are there any other questions for myself or our colleagues, and open it up to the group for questions. So I thank you all for coming today, and we welcome you and your students to the University of Chicago. Thank you very much.